Hi everybody, today we're going to be talking about the psychology pathway. Everything that you need to know if you're thinking about becoming a psychologist, what some of the obstacles might be, what some of the opportunities might be, and hopefully a few hints and tips and tricks along the way. So my name is Dr. Sara Betteridge. I'm a Chartered Counselling Psychologist. I've been working in adult mental health services for over 20 years in lots of different roles, and hopefully you'll hear a little bit more about that throughout the video today. I specialise in learning disabilities and autistic spectrum disorders, working with families and family therapy and incorporating people's faith into their therapeutic work. And I'm joined today by Myra.
Thank you, Sara. I'm Myra Khan. I'm an accredited counsellor. I also work as a supervisor, and I'm the founder of the Muslim Counsellor and Psychotherapist Network, the MCAPN. So, as you said, Sara, so today's video is all about the psychology pathway. And I'm joining you today very much from the position of, because I'm a counsellor, I perhaps am coming from that position of not knowing actually what that psychology pathway is. And so I'm probably the best positioned person to ask you all the questions that a potential psychologist would want to know. Because straight away, the first thing is to say is that the psychology pathway and the counselling psychotherapy pathway are two distinct and different pathways. Right. So having come through the other pathway, for me, I'm going to ask you now all the questions that a potential psychologist would want to know. So I'm going to imagine myself being an A-level psychology student. So I'm just about to graduate or qualify with my A-levels in psychology. But what is the next steps? What is that pathway now to becoming a psychologist, having got A-level psychology?
Yeah, and I think it's important maybe for us to say, Myra, actually how the video came about, which is that both of us get contacted a huge amount about how do we do that, how do we become a counsellor, how do we become a psychologist, what does that look like? And so, you know, we thought it'd be really good to put those two things in a video, and we're going to do another video about the counselling and psychotherapy route as well. So that might be good for people to watch both if they're just exploring at the moment how to get into the helping profession. But I suppose the first thing to say with your question is, you don't actually have to do a GCSE or A-level psychology to go on to do a psychology degree. So even if you haven't done psychology in either GCSE or A-levels, a psychology degree is still an option for you. But if you have and you're thinking about it, either way, one of the first things to think about is, is this something that I am potentially thinking about going into a career into? Because a psychology degree is very similar to other degrees in that you don't necessarily have to become a psychologist after you do a psychology degree. You can use it as, many jobs just look for a degree level in education, in any degree, and that gives you entry to that job. And so a psychology degree would be one of those as well. So many people will do a psychology degree because they're interested in it. That's what they want to do at university. And it may help them in the job that they go for, but they don't, you don't have to then go for a route in psychology. There's lots of other options available to you as well, just with a degree level of education. If you are thinking about potentially going into a career in psychology, you would need to look for a degree that has a graduate basis for registration, and that is with the BPS, the British Psychological Society. And that just gives you, it makes the pathway a little bit easier if you do then want to go into a psychology career, because if you want to be registered by the British Psychological Society, again, it's not necessary, but a lot of people do it. It's a helpful organisation. It's a good method of accreditation to kind of prove your training. And so the British Psychological Society will look at degrees and will register certain degrees that they are happy with the course content and the criteria of the degree, and that will give you what they call a GBR, a graduate basis for registration. Other than that, I would say, you know, do a little bit of research. When I think about myself going into university, I really didn't do as much research as I would recommend people to do. Going and visiting different universities, actually visiting the building was something that I didn't do and I really regretted. So, you know, really going and getting a feel for the university and going with what, you know, what feels good for you. But also having a little look at the level of the psychology degree within that university. So many universities, you know, they've got different levels, but often universities will specialise in certain subjects. So they may not be a particularly well-known university, but they may have a really good psychology department, for example. So it's worth doing a little bit of background checking on what's their psychology department like, do you like the area in the university, and does it have a GBR registration?
So the very first thing, so I'm an A-level psychology student, I'm thinking about going and doing a psychology degree. So the very first thing I want to check is that the psychology degree that I'm looking at in that particular university holds this GBR, this graduate basis for registration with the BPS. And then the second thing I've got from what you've just said, which is really helpful, is to actually go and visit the department, go to the open day and see the quality of the psychology teaching, perhaps what they specialise in, perhaps what research they're doing, just to get a flavour of the quality of the department and ultimately what you're then going to get in terms of quality of teaching.
Yeah, absolutely. Yeah.
Okay, great. Yeah. And so, okay, so then I recognise then that, yeah, I'm about to do my 3-year, potentially 4-year psychology undergrad degree. Okay, great. So off the back of then graduating with a degree, then what? What comes after that? Because I think that is very often the place where you were saying earlier that you get a lot of emails and inquiries from psychology students or graduates like, yes, I've done my degree. But I also get a lot of emails as well from psychology graduates, because I think the pathway after undergrad degree and graduation, I think the pathways are often difficult to understand. So can you talk us through then what that pathway is? What are your options once you've got a psychology degree, and with the caveat that you're wanting to become a psychologist?
Yeah, absolutely. So there's a couple of things to think about. So the first thing that you mentioned is a 3 or a 4-year course. Obviously there's sort of full-time, part-time, but there are sandwich courses as well. So some 4-year courses have a year where you would actually go and work in a kind of a psychology type of environment or a clinical type of environment. And so that's really, you know, that's something to look out for, again, before you choose where you're going to do your degree at. The university will give you a lot of help and guidance around that, but usually you would be trying to get a placement in whatever your research, you know, is the topic of your research, and try to say, for example, I did research on adults with learning disabilities and a type of play therapy, and so I applied to work in a school for children with behavioural and emotional difficulties. So you'd be working there as an assistant, doing kind of, you know, basic level work, but you'd be getting really good experience with clients and different client groups and different presentations and being around all the professionals that work with them and getting a really good feel for what that's like. So that gives you a really good grounding in, you know, is this the kind of career that I want to do? And often, you know, you might be lucky enough if you kind of have really done your thinking and you kind of really know where you're going. Say, for example, you know you want to work with children, even from your degree, you can start to narrow that down and go on a children's placement and do your thesis on something to do with children, and you know, kind of take that through your whole career. Not many of us are that lucky. Most of us, it takes quite a bit longer to figure out kind of, you know, and actually have a bit of experience in lots of different places to see what you like and what you're good at. So that's something to think about, is the sandwich year. The other thing that I would also recommend, again, if you are serious about going into the helping professions, is to you know, if you're going to have a bit of a part-time job throughout university, or you're going to go and do a bit of volunteering, is to do it in those fields, you know, volunteering in mental health charities, you know, working as a support worker in lots of different, I mean, you know, children, learning disabilities, mental health services. There are numerous places that you can work as a support worker. So you don't need to be working doing therapy. You need to just be working with people and working in an environment where you're helping people and you're in contact with vulnerable people or people that are struggling in some way. So the support worker roles, or the nursing assistant roles, or the care assistant roles are brilliant for that, because you're qualified to do that and you get that one-to-one contact with clients. So any kind of volunteering or paid work throughout university that helps you with that is invaluable, actually, and it really helps for the next step. So the more practical experience that you can build up alongside your degree gives you better opportunities when you finish your degree.
Absolutely, yeah. And it's really interesting that you're talking about then whether it's volunteering or a paid role. And again, I'm mindful that, because again, you know, getting lots of emails from psychology students looking for placements, or once they've just qualified, about to graduate, looking for a placement. The thing that I'm really mindful of is that a psychology degree, though, whilst it trains you, it gives you that foundation for what you're going to do next. The psychology degree does not qualify you to start working therapeutically with clients. And the reason I want to make that really clear is because I'm inundated with psychology students or graduates saying, Myra, please, can I come and do a placement with you? Can I shadow your clinical work? Can I just sit in on sessions? And unfortunately, I'm like, absolutely not. So I think there is this kind of fantasy or myth around, well, I've done a psychology degree, I've done a module or a semester on Freud psychoanalysis, or on a therapeutic modality. Having studied it theoretically does not give you license or the qualification to then go and do that work therapeutically. So the thing I would really want viewers of this video to learn, that if you're studying psychology at university, it does not give you, unfortunately, it does not give you the qualification to then go and do the therapeutic work. So the idea of, right, I'm going to go and do a work placement in a therapeutic service or in a counselling service and actually do the clinical side of things, that is just completely off the cards. What you might get is an opportunity to work in the office and do admin work, do the support work around the service, around the therapeutic work, but certainly not within the therapeutic work itself. And I really want to make that clear, because, as I said, we get so many emails from psychology graduates wanting to come and, you know, work, volunteer, do a work placement with us, come and, as I said, come and sit in on our sessions. And I'm like, you're getting nowhere near our clinical work, because unfortunately your psychology degree does not train you to be a clinician.
No, that's right. It's a theoretical degree, and you do a lot of research and you learn a lot of theory, and it's, you know, invaluable for kind of moving on in that career, but it does not give you practical training on how to do therapy with somebody. And so the kind of jobs that I was talking about that you'd be looking for would be jobs that anybody can apply for. You know, that kind of, you know, working for Mind, or working for Rethink, or you know, in those kind of admin roles, or you know, project roles, or care assistant or support worker roles. So they're not roles that you need a psychology degree for, but they're roles that will give you direct one-to-one contact and work with vulnerable people and people that need support. So you'd be at that level, you'd be doing a lot of practical support, but it starts to, you know, on your CV, when you're going on to the next step, the fact that you've worked with people that are struggling with these issues is a big plus. Not in a therapeutic way. You might be helping them do their shopping, or helping them with their personal hygiene, or whatever that might be, but you are getting to know them, and you're kind of, you know, getting a really good experience of working with them. So yeah, it's those kind of roles that will help
absolutely.
you.
Great. So I'm choosing, so the place where we're at on this pathway is I'm choosing between a 3 or a 4 year course. And and the bonus of perhaps doing a 4-year course is that, of course, it offers you the opportunity then to be on a placement and to get some hands-on experience just working in the field, not therapeutically or clinically, but just in the field. And also that those work placements, those roles may also then support you. Of course, they're your placements to do your research then for your final dissertation. Okay, great. So I'm at the point of graduating. Well done, everybody. You've graduated with your psychology degree. So you so at that point you have your undergrad psychology degree. You're a psychology graduate. Because you will have done your homework and have chosen your degree that has GBR, your graduate basis for registration. What next? What are you then looking at?
So there are a number of different options at this point. You know, first it's important to say you can go off and do whatever you want to do with a psychology degree. So you know, there's that option. The second option is to get a job as an assistant psychologist. So if you are thinking about becoming, sorry, let me take a step back from that. So if you're thinking about becoming a psychologist and you want to kind of have that title and work as a psychologist, there are a couple of different ways of doing that, or 3 main different ways of doing it. So there are some psychologist positions that require a master's, and after the master's you can then practice as that psychologist. And there are some psychologist positions that require a doctorate level training, and once you do the doctorate then you can practice as that psychologist. So this is where it's, you know, helpful to start to think about what kind of psychology do I want to go into. So with the master's levels, there are things like a health psychologist, a forensic psychologist, although I think that a doctorate is coming out in that, but there is a master's, occupational psychologist, which is working with businesses and organisations and companies, sports psychologist. So there's a couple, you know, a number of sort of different psychologist roles which you can go and do a master's in those things, in sports psychology or health psychology or forensic psychology, and you can start to practice after your master's. You know, that you'll be getting more experience in that field, you'll be doing more research in that field. Again, I'm not sure how much practical, you know, experience you'll get of delivering therapy on the masters, but you know, that's what you'll be working towards, and certainly with a master's in that you can then you know, go and specialise in that field and practice in that field. However, one thing to say is that if you do choose that pathway of a master's and that kind of psychologist, you can only practice in the field that you've done the master's in. So, you know, if you did a health psychology master's and you're practicing as a health psychologist, you couldn't then start working as a forensic psychologist or as a business psychologist unless you went and did some more training in those fields. So the masters will direct you to a particular type of psychologist, and that's kind of the field that you'll need to go in.
So just to kind of clarify that, so at the point that I've graduated, if I know that I want to become and work as a health psychologist or a sports psychologist, forensic you mentioned as well, it becomes a very particular single pathway that you then go on. I do the masters in it, and then I go and work as that particular specialist psychologist, and they're not interchangeable, as you were saying. So there is something about the point that I've graduated, I've got to actually be really clear about what my end point is going to be, because the type of psychologist I want to be is going to then determine the next step that I do once I've graduated with my undergrad degree. So as a health psychologist, sports psychologist, forensic psychologist, if I want to do any one of those, there's a very particular master's that I go and do, and then I can practice and be a psychologist and practice as that psychologist in that field. Okay, great. That's really helpful to know, actually, that there's something about, I'm going to choose that particular type, specialism of psychology. There is a master's to do in it, and then I go on and become that type of psychologist and nothing else.
Yeah, absolutely. And you might even, you know, if you do, for example, sports psychology is really popular at the moment. You know, if you know that from your psychology degree, then you might do your thesis in something to do with that. And if you do a 4-year sandwich degree, you might kind of look for a placement in that. I live in Scotland, and Stirling University has the Institute of sport connected to it, and it's really big up here, and you know, so there are lots of things that could be potentially available to you if you're lucky enough to be one of those people that knows what you want to do and you know how you're going to get there. So you can start to specialise in your undergraduate degree. For a lot of us, we haven't got a clue what we're going to do, and so what I would say after your degree is to go and do a year of finding out and working and doing volunteering and going and, you know, trying. It may be that along the way in your work you've found something that you really like. It's like a children's placement or an older adult placement or something, and you thought, oh yeah, this is me. So the working and the volunteering is so key. You know, I think people sometimes just think about it as earning a bit of pocket money through university, but it is so much more than that if you're doing this kind of thing. Because you really get, that's how you get to know whether you really want to work in these sorts of areas or not, and which type of areas you'd like to work in. So I really, that is, it's almost as important as your degree. Certainly it was for me when I did my next step. It wasn't so much my degree that got me the job, because there was hundreds of people with a psychology degree that had applied. It was my work experience working with adults with learning disabilities throughout university as a support worker that then got me the job as an assistant psychologist in adult learning disability services. It was that experience, that hands-on work experience. So that's for the sort of specific masters in different types of psychology. There are three main types of psychologists where you need a doctorate level training for. So that's a slightly higher level than a master's, and the research is at a slightly higher level, and it gives you a doctorate title at the end of it. It's also a practical doctorate, or professional doctorate is what they call it. So it's not just research, it is you're working throughout the doctorate as well. So it's placements and training, and placements and training and research. So it's all three of those in one. And they are a clinical psychologist, a counselling psychologist, and an educational psychologist. As I mentioned earlier, I think forensic might be going that way. I'm not sure if that's happened yet or not, but certainly clinical, counselling and educational, you would need to do a doctorate before you could practice as a clinical, a counselling or an educational psychologist.
So I'm imagining myself as a viewer here, so I know that, okay, I've got my psychology undergrad. What's the bridge then between having graduated with my undergrad degree and then getting onto that doctorate? So walk me through the steps of, I've just graduated with my GBR, graduate-based registration. So, you know, so something about the credibility behind my undergrad degree. Is it then a case of doing a master's and then doing a doctorate? So yeah, talk me through what are the steps between being a graduate and then getting onto one of those doctorates, if I know that, yes, I want to become a clinical, counselling or educational psychologist.
Yeah, it's slightly different for all three.
Okay.
So if we start with the clinical, because that's the one that people kind of know most about, and is the route that, so we can kind of start with a best case scenario route, if you like, which is that you would do your degree, you would get a job for at least a year as an assistant psychologist. So these posts are advertised mainly by the NHS, but there are some private organisations that do them as well now. It's a graduate level post, so you just need a degree in psychology, and it's as an assistant psychologist. So you are the assistant to the psychologist working there. Again, a lot of the role may be admin based, but you will also be supporting the psychologists in the team to, say, for example, deliver courses or run workshops, or, you know, so you're really starting to get, you know, you'll be there as part of the team, but you know, maybe once you've trained a bit and had some supervision, you may be able to do some one-to-one on the kind of mild to moderate cases. So you'll start to get some real experience of that kind of a role. And then after a year, you would apply to get onto the clinical doctorate in psychology training. Now, this is a NHS funded training. So there are a number of universities around the country that offer it, and it's usually affiliated with the local NHS trust in that university. So if you get onto that course, most of your placements will be in and around that university with their local NHS trusts. and you receive a wage so an assistant psychologist has a wage, and then a clinical trainee psychologist is also paid by the NHS, and their course is funded. So the course is funded, you're receiving a wage, you go to uni, you go to your placements, and you do your research, and that is a 3-year doctorate level course. Now, because it's funded and paid for, it's an incredibly competitive course. It's notoriously hard to get onto, and it's quite normal for people to apply for 2 or 3 years and go through 2 or 3 rounds of interviews before actually getting on to a course. And we could make a whole other video of how to apply for that and what that's like, and you know, so it's not easy. And because of that, they then obviously look for people that have got the highest grades and that have done the most volunteering or work in that field. You know, the kind of level is really quite high. There's a lot of work being done in the field to increase diversity, because it hasn't been a very diverse profession. So yeah, there's those sorts of movements happening too, but nevertheless it remains quite a competitive course to get onto, understandably. So a lot of people have been doing a master's before that, you know, so they've been doing a master's, working as an assistant psychologist, basically anything that they feel will boost their CV to give them more of a chance of getting into the clinical doctorate. You don't have to, but because it's so competitive, that's what people have been doing.
And actually, I think that's actually really helpful to know. So having got your undergrad degree, the kind of compulsory mandatory route is that you need to go and do your assistant psychology post for at least a year and then apply for the doctorate. The master's is additional, it's a bonus, you don't have to do it, but it's there because getting onto the doctorate is so competitive that a master's might help you just to kind of edge you that little bit closer to getting in. So unlike the kind of the health psychology, sports psychology, in which the master's is the compulsory core part of training to go on and be qualified, for clinical psychology, the master's is additional. You do it if you want to, and if you perhaps are struggling to get onto a doctorate program, you can do your master's in the meantime. Okay.
Yeah, because if you think about a doctorate, say it's a 3-year doctorate, the first year is at a master's level, and then you move up to a doctorate level. So you're doing a master's within your doctorate. So there isn't an academic need to do another master's beforehand. Yeah. But it is, some people are finding that it's helping them just to get more knowledgeable about clinical psychology. A lot of people do those masters, again, not going into being a psychologist, but it will help you to get other roles in the field. But yes, we are finding that a lot of assistant psychologists are doing those masters. The other thing that people are doing is the PWP training. I'm not sure what that stands for. Wellbeing practitioner, I think.
Yeah, psychological wellbeing practitioner.
That's something that's becoming very popular for people who are trying to get onto clinical training. They're sort of doing that route. There's actually a new clinical associate position. It's a fairly new position for people that have got a psychology degree, got some experience, are trying to get onto the clinical training. It's a bit more of a sort of practical, a bit similar to an assistant psychologist, but they're really trying to kind of train you up to get on to then the clinical training. So there's actually quite a few different, there's assistant psychologists, there's PWPs, there's clinical associates, there's masters, there's a few different things, but essentially it's all about building up your CV so it's good enough to get onto the clinical doctorate. And there's lots, I think, available on the internet on, trying to apply for a clinical doctorate training, what the interview process is like, what the application process is like, and things to think about, because it's quite substantial and significant. But just to sort of make people aware that it can take a few years of applying to get on. That's okay, that's normal, and in those few years you'll just be getting, building up your experience in the field in lots of different ways. So that's not a bad thing.
No. And I'm also thinking as well that the fact that there are kind of these 3 or 4 different ways, optional or additional ways to get onto a doctorate program, Of course, then depending on where someone's based in the country, what their circumstances are, one of those pathways onto a doctorate might actually be more accessible for them, might be easier for them to do, because of course not everyone might be able to go, right, well, I'll go and do a master's. It might be, no, I need to just go and do a job as an assistant psychologist, or go and do the training and work as a PWP. So I suppose it's actually really helpful to know that there are 3 or 4 ways that eventually, there are 3 or 4 different optional pathways, or different pathways, for which you'll ultimately end up, hopefully, on a doctorate. But whichever pathway you choose, it's the one that kind of best suits you, or the one that's most easily available for you. That's really helpful to know.
It does. It very much depends on personal circumstance, and you know what's going to work for you, really. I suppose it would be good for me to just say a little bit about educational psychology, because that's the one that I know least about. So I'm wondering whether it's similar in that that's funded by education authorities. I think it might be. I think it's quite similar to sort of teacher training and things like that. So that's something that people would need to go and find out about. I don't know a huge amount about it, but I know that it would be a doctorate training in educational psychology. I believe that there is some kind of funding and payment similar to the clinical, but for education. And I'm just thinking as well that, so if for anyone watching this, that if they are particularly interested in the educational psychologist route, I'm sure that there will be lots of information on the BPS website about what that very specific pathway looks like. But what we can tell you for definite is that you will need to go and do the doctorate in it. That is the prescribed, structured pathway to go on and become qualified as an educational psychologist. So again, helpful to know that. Yeah, and also just you just made me think that, you know, you don't have to necessarily do your degree and then work for a bit and then get onto that. Many people come to a doctorate much later on in life. They've been working in education for years, or they've been working in mental health services for years, and think, no, actually, I want to go and do some research in this and do my doctorate in it. So yeah, it's definitely something that is available to anyone. You have to have a degree to be able to do a doctorate, but actually, you know, there are lots of, especially for older students now, there are lots of different ways and lots of different kind of routes into university now. So it's definitely, and actually mature students, you know, I know are very welcomed on psychology doctorate training courses, because there's experience that they're bringing with them and maturity, which is great. So yeah, something to think about as well if you're, you know, in that part of your life and career. So the last one is the counselling doctorate, which is how I train. Now my whole route was very unusual in that I was an assistant psychologist in learning disability services, and the team was clinical psychology. And so the majority of my training has been with and by clinical psychologists. I was fortunate enough that this particular trust was funding one counselling psychology doctorate. So the big difference, there are 2 big differences. One big difference is that counselling psychology is not funded by the NHS. So people that take the counselling psychology route would need to pay for the course. Then they're not in a paid job. So, you know, they would either need to find a paid job, or they have to have placements, whether that's paid or not, to do the course. So the cost of doing a counselling psychology doctorate is substantial and significant in comparison to the clinical, because you're paying for everything. You're paying for your supervision, you're paying for your course, you're paying for everything that you need to pay for, your therapy, personal therapy, which on counselling you have to have. And you may or may not be in a paid position, and you may need to work on top of that to support yourself through. So it's a completely different ball game. I was, alhamdulillah, very, very fortunate to be given an opportunity to have it paid for by the trust that I was working in. And so my training looked very similar to a clinical psychologist training, in that I was employed as a trainee psychologist in the trust. They were paying for my doctorate, and I was doing all my placements with them. So again, I was being supervised by clinical psychologists, but my training was counselling. The other main difference between the two is with clinical psychology courses, you will need to do placements in the different fields. So within clinical psychology, that is usually split into child and adolescents, which is up to 18, adults, which is 18 to 65, older adult, which is over 65, and learning disabilities, which is people that have cognitive disabilities, usually sort of IQ below 70 kind of thing. So they're the sort of four main fields. There are lots of fields within that, but they're the four main fields. On counselling psychology, it's not split in that way. So you could have an adult placement the whole way through. You're encouraged to have a few different types of placements, but you don't need to sort of go to all of those four. So there's a sort of slight difference in maybe, you know, the client groups that you're working with, and with counselling there is more of a focus on the therapeutic modality and training in the therapeutic modality. Clinical has a little bit more of a focus on neuropsychological assessments and diagnosis. Again, you know, you get a bit of teaching on both in both, you know, but it can be a little bit more sort of clinical focused. You don't have to have personal therapy on the clinical psychology training, whereas on the counselling psychology training you do. Being a reflective practitioner is really, really key. But you will get variations within. So, you know, as a counselling psychologist, I can do neuropsychological assessments and have done them. And I know many clinical psychologists who are amazing, you know, therapists. So it kind of depends on your own personal style as well and what you're interested in. But it's not so competitive because it's so expensive, and there, you know, so it's a very, very different training in that sense. You have to go off and find all of your placements. You have to, you know, it's not set out and it's not given.
Yeah. So what I'm hearing straight away is that with the clinical doctorate, it's all provided for you essentially. It's all funded for you and paid for. With to go and do a doctorate in counselling psychology, there's something about you have to be able to provide it all yourself or fund it all yourself. So that's kind of a huge difference between the two. And again, I'm thinking viewers watching this are going to be thinking now perhaps, gosh, that's really going to influence which route I go down. But also, again, really helpful to know that, because if you're just graduating or you're doing a psychology undergrad thinking, I want to become a counselling psychologist, now that you know that you've got to fund that all yourself, I can understand that may well influence you going, right, well, I'll switch to clinical. And I can appreciate that because not everyone's in a position to self-fund the route of counselling psychology. So
yeah, and unfortunately it doesn't quite equate to that because clinical is so competitive. So for a lot of people, doing the counselling psychology and finding the money for it can be the difference between becoming a psychologist or not.
Right.
Because you may never get onto the clinical training.
True, yeah.
But you can get onto the counselling training if you can find the money from somewhere.
Yeah.
So for some people it may come down to that.
Yeah, absolutely, yeah. And so in recognising that with the clinical psychology doctorate, that's a 3-year programme, all funded. With the counselling doctorate, I'm assuming that's 3 years as well? Yeah. Yes,
it is. Yes, yeah. I mean, I did it 4 years part time, but it is. It can be 3 years full time. Yeah.
And again, the pathways onto the doctorate in counselling psychology. Again, is it similar advice with the clinical psychology, that PWP training or doing a master's or getting a job as an assistant psychologist? Is it the same pathways then onto the doctorate in counselling psychology?
I wouldn't say masters, you wouldn't need to pay because it's not competitive in that sense. And the first year is a master's level. You wouldn't, I would say not to spend the money doing a master's because you can just apply for your doctorate. But in terms of the work experience, absolutely, just as much work experience in the field that you can get as possible. Okay,
great. So that's been kind of mapping out the pathways for us. So we now recognise that to become a clinical or counselling psychologist and educational psychologist is absolutely to get onto that 3-year, so 3-year full-time, 4-year part-time doctorate in either clinical or counselling psychologist. What then is the potential at that point? What does that lead me into doing? What does the landscape look like in a nutshell after I've graduated or qualified as a counselling or clinical psychologist?
So both a counselling or clinical psychologist after a doctorate will be able to work therapeutically with people. So their training does incorporate training in therapy. Most of the courses now will do at least a year or two in CBT and another type of therapy, whether that's psychodynamic or systemic, and some courses like mine will have a third as well. So you get a very good grounding in at least 2, if not 3 types of therapy, and you would be seeing clients using that therapy, writing case studies using that therapy, and having lectures on the theory. And so, you know, you're getting the full experience of delivering that therapy. And with the clinical, you're also getting a full experience of working with lots of different types of client groups. So you know, by the end of that, you should have a sense of what you prefer and where you would like to go. So after your training and your research is at a doctorate level, so it's a really, you know, intense, significant piece of research. You can publish your work, you can specialise in that field, you become a doctor. The BPS gives you a chartered register, a chartered title that you can use if you register with them. So, you know, it's really then about exploring what you want to work in and where you want to go. The difference between the doctorates and the master's psychologists is that with the doctorates, you can still then choose to, if you wanted to go and work in forensic services or health services or education, or sorry, not education, or business services, you can then go and do whatever course you want to do and specialise in whatever. So the doctorate trainings give you a much bigger scope. With the master's psychologist, you can only work in that field. With the doctorate, you can go and then specialise in whatever you want to work in. And that's what people then do. They kind of, some people are lucky enough to know from way before what they want to work in and where they want to go, and that's what they pursue. And for some people, they then spend the next few years working in different places, getting a feel for, you know, where they want to lay their hat and specialise. And some people move around quite a bit in different services. They're all very transferable skills, but obviously, you know, working with a child will be very different to working with, you know, an adult. So, yeah.
That's great. And I heard you mention, and that was, I suppose, my next question around becoming chartered. And I appreciate that, because the psychology profession is what we call a regulated profession. The titles of what you can call yourself as a psychologist, they are protected titles. So at what point can you start using titles, and at what point do you become chartered? So you've just mentioned that at the point that you qualify and graduate with your doctorates, then you become, in my fancy of walking us through this pathway, I've now become, for example, I've done my counselling psychology doctorate and I'm now Dr. Myira Khan. At what point then, is it at that point that I use the title of counselling psychologist, and is that protected? And how do you become chartered? So just, can you talk us briefly through those two?
Yes, and you and I have spoken about making a video for clients who are looking for therapy, and you know, this is a really important thing in terms of when you're trying to look for a therapist, what do their qualifications mean? So please do watch that video if you want a more in-depth explanation of this. But just for this video, in terms of if you're thinking of becoming that kind of professional, not all of the psychologist titles are protected, unfortunately. So many people after just a degree are calling themselves a psychologist. After a master's, you know, some of people can, some can't, depends what masters you've done, but there isn't anything that could stop you from calling yourself a psychologist after you've done a degree or a master's. So it's not protected in that sense. What is protected is if you are a member of the British Psychological Society and you have a chartership, then you apply and they look at your qualifications, they look at your modules, they look at your training and what you've done, and then if you meet their criteria, you can become a chartered psychologist with them. And that just says that you have, you know, done a certain level of training, and it's a good level, and it's approved by them. So when you're calling yourself a psychologist, it's, you know, you've got good reason to, and you've had enough experience and training to be able to do that. The doctor title is protected in the sense that you have to do a doctorate in order to call yourself a doctor, and the doctorate trainings both in clinical and counselling are robust, and you know, you would have had a lot of experience doing therapy and working with clients. The counselling psychologist title and clinical, so you know, but not that long ago, maybe, I don't know, maybe 15-20 years ago, they weren't doctorates. So you can be a clinical or a counselling psychologist without having done a doctorate. So again, then it's more important for a client really to understand what the difference is and what somebody's training is. If you, so for example, one of my old supervisors was from the generation where clinical psychology was not, it was a master's level, it wasn't a doctorate level. So she was a clinical psychologist and you know, in a very high position, but later on in life decided to do a top up of a doctorate to get the doctor title. So that for her was actually purely research based thing to get that doctorate title. It wasn't anything to do with clinically, because she'd been working as a clinical psychologist in the NHS for decades. So, but now that doesn't really exist. It is all through these doctorate trainings. So if you have come across a doctor in clinical or counselling psychology, that's a good sign that the level of training has been good. If they're chartered, it means they're registered with the British Psychological Society and their training has been checked and that it meets a certain standard, so that's even better. But there's also other places that people can get accredited with. So psychologists often use the BACP, which is the British Association for Counselling and Psychotherapy, and I think the one for cognitive therapies as well. I've forgotten what that one is now.
BABCP.
BAPCP. So all of those, you go through a process of them assessing how many client hours you've done and what your training is, and you know, fill out all of those forms, and if you meet their criteria, you can get accredited by them, and that would be in terms of delivering therapy. So not everybody is registered with the BPS, because some people choose not to be, but you can, there's still a way of checking what people's actual training has been. And
so straight away, what's become clear to me then in you saying that is, of course, at the point that you graduate and qualify with your doctorate, you become doctor. So in my fantasy pathway here, I've become Dr. Myira Khan as a counselling psychologist. To become chartered then, it's not automatically embedded in your graduation, because to become chartered then is separate. So I've become Dr. Myira Khan, counselling psychologist. To become a chartered counselling psychologist, that's when I have to opt in to applying to the BPS to get that title. So again, I just want to make it really clear to viewers that becoming chartered is not an automatic kind of milestone that you reach just because you've got your doctorate. And I think that's actually, again, really helpful for people to know. So again, at the point that you've become a doctor, you've graduated with your doctorate, you then have two different pathways that you can go down in terms of verifying or giving credibility to your doctorate, either via the BPS route and becoming chartered, or becoming a member with a counselling psychotherapy membership body, such as the BABCP or BACP, for which you can then become a registered member with them. And it possibly will come up in the counselling video that we then talk about becoming accredited with those professional bodies. But actually, no, really, really useful to know then that if I'm setting out to become a chartered counselling psychologist, that it's about doing the doctorate in counselling psychology, and then to become chartered is to apply to the BPS to verify my qualifications, and they award me with becoming chartered.
Yes, and I think it's important to say, you know, obviously one of the major differences between a a clinical counselling psychologist and a counsellor and psychotherapist is the doctorate part. And that is about research. That is about level of research. So on a doctorate level research, you are doing a very high level of research in the field of counselling or psychotherapy or psychology. So that is one of the bigger differences. So it's not necessarily about the clinical work. Often that level is fairly similar if you do a high level of training in your counselling and psychotherapy, but the doctor bit is about the research that you've done. So, you know, a clinical psychologist might do it on quite clinical things like, you know, autism, or I'm trying to think of some more kind of quantitative studies. You know, if you're looking at sports psychology or, you know, forensic psychology, they might be quite focused on something quite quantitative, whereas your counselling psychology research, and for some clinical trainees too, it's more around people's experiences and people's sometimes experiences of therapy or experiences of trauma, or, you know, and it's more qualitative. But whichever way, you're doing a very high level of research into that field. So it makes you, you know, you're at the beginning levels of becoming a specialist in that field. So for example, my doctorate was on incorporating faith into therapy, and so, you know, with that alongside the work experience that I've had in that field, I would consider myself to be a bit of a specialist in that field because of the level of research and work experience. So that's one of the main differences, is that you can start to become a bit of an expert, a bit of a specialist in the field that you choose to research in.
Yeah, that's great. All really helpful. Thank you so much. As somebody who absolutely, because I went down the counselling therapy pathway, the pathway you've just described for psychologists absolutely makes it really clear then about, based on where I want to end up and how I want to be working as a psychologist, there's actually really clear structured pathways that, you know, I can then choose to follow to then become a counselling or clinical psychologist, or health, sports, or educational psychologist. Thank you so much, Sara. Anything else that you think a psychology student needs to know? Any other hints or tips?
I think you know, from talking to you, I think what I would say is that for most people, they don't know what they want to do. They kind of roughly know they want to work in this field, but they don't really know what to do. If you are lucky enough, and I would say it's a real small minority of people that from degree level, they know, right, I really want to work with autistic children. And so their whole kind of pathway can be focused to that. Fantastic. But if that's not the case, don't worry. Don't worry. At every step, degree, you know, a bit of work experience in between degree and next step, whether that's assistant psychologist or support worker or whatever, then the next step. At every step, there is lots of different things that you can explore and think about and try out to make your decision about the next step. So what I would say is you don't need to know exactly what you want to do right at the start. There is lots of opportunities at each step to actually go and do something completely different, but not waste your degree, or you know, still transfer skills from that. Or you will come across things that you've never even thought of before and think, wow, that really interests me. I want to try that. Or you might come across a number of different things that you like. So don't worry if you don't know exactly what field you want to go into. There will be enough opportunities at each step for you to explore different things and make those decisions as you go along. Because for a lot of people, you know, they'll try for a couple of years to get onto clinical and it might not work, and so they might decide, actually I quite like health psychology, so I can just go and do my master's in health psychology and practice as a health psychologist. Or, you know, I'll try the counselling psychology, or actually I don't have enough money for a counsellor, so I'm going to go and do my psychotherapy training, you know. So I would say we're going to obviously talk about the counselling and psychotherapy training where you don't need to do a psychology degree. So that would be the biggest thing, I think, is the psychology degree to start with. If you're somebody that knows that you want to do therapy with someone, you don't necessarily need to become a psychologist. to do that. So you don't necessarily need to do a psychology degree, and we'll tell you in the next video about, you know, what your other options are. If you know right from the start, and I do meet a lot of people like this who are like, I just want to be able to do therapy with people and work with people and help them in that way. Well, then no, you don't need to go and do a psychology degree or a master's or a clinical you know, that's, if you want to become an expert in that field or specialise or do the research, then that might be a trajectory for you. But if you really actually just want to work with people in a therapeutic way, there are many other different options of doing that. So that's what you need to think about right at the start. What do I want to do at the end of this? Do I want a certain level of academia? Because that's what the psychologist route does, is it moves you up in levels of academia. And, you know, I could go and become a lecturer or do other things in academia or more research-based jobs as well. That's the other thing I didn't mention is, you know, with your training in clinical counselling psychology, you can then obviously work in universities as a lecturer or researcher as well. So you again, you don't necessarily need to do clinical work with people, but you might be doing the, you know, research work behind, or academic education work. So there is a big difference in level of education and whether that's what you want to go for or not. But if you're focused on actually just wanting to do the work with people, you could go down a different route. And then later on, as I mentioned earlier, if you feel like, do you know what, I'm passionate about this and I want to research this, you can then still go and do that later on down the line as well. So yeah, just if you're doing your A-levels, having a think about, you know, how much education do I want to do and to what level do I want to do it at? And what is my goal really? Is it more to work therapeutically, or is it that I do also want to, you know, go down that kind of education route as well? So that would be the biggest thing to think about. And then moving on from there, once you've kind of thought about that, is to kind of, it's a middle line between having a bit of direction, but you don't necessarily need to know every single step that you're going to take.
As well as kind of don't also then be wedded to it as well.
Yeah.
Because once you, as you're doing your psychology undergrad, you might then come across a module or a unit that you go, well, on paper, I wasn't that interested in it. But then once you do the module, you then realise, actually, I really enjoy this. So also be open to your trajectory or your pathway changing during your undergrad as well. And I think this is where placements, work experience also are really helpful, because they are going to help you potentially identify what you want to do, or they're actually going to eliminate options that you thought, oh, I really wanted to be, I don't know, working in health psychology, and then you go and do a placement and realise, nah, not for me.
Not for me.
So I think what I'm really hearing today is that when it comes to doing your undergrad, your psychology degree, because it is a rounded degree, it covers a bit of everything. Actually, that's a really good time just to play with ideas about what you want to do afterwards. And then afterwards, you've still got a year or two to play with in terms of experience, work placements, assistant psychology roles, potentially doing a master's. You've also then got kind of a buffer there of 1 or 2 years. So whilst you're gaining all of that experience and a master's potentially, you can then decide whether you then want to go on to doing a doctorate or not, or kind of take a side step into counselling or psychotherapy. Which is, I think it's really important just for viewers watching this, if you're at this kind of GCSE A-level point, or even actually if you're potentially doing your undergrad right now or about to graduate or having just graduated even, have a play with what it is you want to be doing afterwards. And then obviously, thanks to Sara, you describing those different pathways, you've now got an idea, hopefully, which pathway you now need to go down based on thinking about what you want to be doing at the end of it. Thank you so much. I mean, I've learned from today as a psychology undergraduate. I have a degree in psychology, but I didn't follow the psychology route into me working as a therapist. So for me, I've absolutely, you've really well explained today what those different pathways look like. So thank you so much. And for the viewers watching this that are thinking more now down the therapy route, thinking about becoming a counsellor or a psychotherapist, we have another video that explains those pathways to you.
Thank you.
Thank you.